Hello, everyone. My name is Lizzie Wilson, and today I have the pleasure of discussing the innovations in assessment and resource dissemination that have been made by Helping Give Away Psychological Science. Helping Give Away Psychological Science, or HGAPS, is a nonprofit or 501c3 that was established in February 2018 by Dr. Eric Youngstrom and Dr. Mian Leong, and also functions as a student service club. The first chapter of it was established at UNC Chapel Hill, and includes about, to this day, 35 different undergraduate students, as well as some grad students and postbacks. But other chapters have been established at Appalachian State, the University of Maryland, and UCLA, all of which specialize in different things. But they're all under the general vision of bringing um, free, accessible information to more people that need it. So bridging the gap between students, clinicians, researchers, and the public by creating and spreading accessible and free resources. The way that this was originally imagined was to spread evidence-based assessment, or EBA, to new audiences, especially clinicians, to encourage them to use it. And we've been finding more innovative ways to achieve this goal over time, one of which is the assessment center. Over the years, we had seen numerous examples of organizations putting up free assessments or evidence-based assessments over the internet, but we had been compiling these assessments over the years in ways that were a little bit less accessible, like compiling PDFs and anchor publications. And what we decided to do is code these assessments into Qualtrics and then put them up onto the internet on our website so that more people could use them. The main goals of this assessment center would be to make it easier for clinicians to use EBA, and also to function as a new pipeline for those who need psychological help. To make it easier for the general public to access information about their mental health and then be piloted to resources for getting help thereafter. So empowering the general public to be able to take their mental health into their own hands and actually find an interactive way to understand that information. Before walking through the resource itself, wanted to go over a little bit about the making of the assessment center. So we started off by compiling a list of the best of the free assessments, meaning evidence-based assessments that are also free, so non-proprietary, meaning that we could code them and put them up. And these were picked by different experts on different disorders and symptom areas. So we contacted colleagues who were specializing in different symptom areas, and asked them for their opinions on the best assessments in their areas, as well as looking at different reviews and meta-analyses to determine which is the best performing. Um, all of the assessments that we have coded into the assessment center were compiled by 10 undergraduates over the last 4 semesters on barely any money and a budget that included mostly pizza to feed these undergraduates. But what that's compiled into is about 70 total assessments over the past 4 semesters. So a very large catalog spanning a wide area of disorders and symptom areas. Then we put all of these assessments on the assessment center and tried to create an ecosystem that was compatible with clinicians' needs and also met legal criteria for being exactly what the general public would need without triggering them or being in any way overstepping. Um, and then we've linked the assessment center to different professional society sites. The first one that we linked to was the Society for Clinical Child and Adolescent Psychology, or SCAP. And I think that this has driven quite a lot of our traffic to the site. The assessment center platform itself is twofold. So one side of it is only available to clinicians, and one side of it is available to both the general public and to clinicians. The general public side is the front-facing side. So it's the side that people see as soon as they navigate to the assessment center, whereas the clinician side is hidden by a couple scrolls down. The clinician-facing assessment center has over 70 total assessments that we've coded into Qualtrics in it. So they are listed off by disorder or domain so that there are duplicates likely in each category. For instance, there are about 10 different depression assessments that we have coded in dependent on what the clinician's preference is. The clinician-facing assessment center was intended to be utilized by a clinician interfacing with a client. So the clinician is there either with the client or has sent the client instructions beforehand on how to take this assessment. So they're not designed for a member of the general public to be taking them by themselves. This was intended by design because part of the feedback that we've gotten in stakeholder panels and from the legal team is that it likely would be irresponsible to give the general public access to maybe 10 different versions of a depression assessment, and allow them to have access to the tools that clinicians are having. So we've decided to create that into its own thing just for clinician use. What we're giving instead to just the general public, although these are also available on the clinician facing assessment center, are 3 assessment batteries that are geared towards 3 separate informants: adolescents, parents, and adults. These assess about the 6 to 8 top domains that are primary clinician concern areas to assess. So for instance, anxiety, ADHD, depression, PTSD, things of that nature. But again, the breadth of the clinician facing assessment center covers content areas that aren't assessed in the batteries themselves. So a clinician would be able to dive into that repertoire and pick and choose other things that they would like to assess, for instance, autism or borderline personality disorder. Each of the assessments contains an introduction, instructions, and a disclaimer that we sought legal consultation on. This is again to inform the participants or the general public that is taking this of exactly what they're getting into and give them the instructions, and also crisis management and psychological first aid on the front end and on the back end to make sure that we're not doing this without the proper reinforcements to make sure that people are handling this well mentally. We also have a demographics section, which will be important for clinicians to assess for culturally and racially informed care. That's followed by the questionnaire itself, and also an end screen that we call the back message. This has the calculated scores, so the clinicians don't themselves have to score the assessment, nor do the general public. A PDF printout of the results, so that if, for instance, a clinician were to send an assessment home with a client, or before the client arrives and do some preliminary assessment, the client can print out that PDF or send it to the clinician, so that the clinician would have a way to save that. And then resources for the general public and tools for clinicians are also attached, and I'll be going into those next. So again, we have some supplemental tools that are attached both to each individual assessment that we have for easy access by the general public and clinicians, and also they're linked and embedded into our website. So first we have general public resources, which is consisting of resources divided by content area that the assessments assess, and it's linked directly on the front page of the assessment center so that the general public can find this immediately if they're searching for help. It's also linked to the end of every single survey that they could take, so that at the end, when they get their score, they have a place immediately to go to seek more information about those resources. The clinician tools not only link to information about each of the assessments, this entails the anchor publication, an original PDF that we use to code the Qualtrics assessment, and then also how we scored it for each assessment. And then also we link to other tools that could help with the EBA process. For instance, we link to PracticeWise, which has an array of tools that could be used to help with assessment, such as trackers for idiographic tracking of different symptoms across time for different participants and things like that, that could assist with this process. Part of assessing how well the assessment center is doing and if it's a valuable service to the people that we're offering it to is assessing the uses over time. So we did a pilot study with the Depression and Bipolar Support Alliance to test how well an assessment center could do on a website like that has that kind of platform. We put up these assessments, which there are about 9 of, to similar informants and audiences that we currently cater our assessment center to. And over about a couple of years, there have been over 32,000 uses on these 9 different assessments. So it's safe to say that this is reaching a lot of people across a varied audience, both adults, parents, and children. We tried to cater our assessment center to a similar audience. And so far, in about 2 months of full operation, we've garnered significant traffic. So all assessments in the clinician assessment center, which are like the 70 assessments that we have that the general public doesn't have access to, have been used over 1,200 times. The total for the batteries, so adults, adolescents, and parents, was a little bit over, actually close to 1,800 uses. This is a total of a little bit over 3,000 views in the past 2 months, and this is without a ton of dissemination on our part. Um, and we hope that part of why this presentation will be helpful is to be able to give y'all, the listeners, this tool to be able to use so that it reaches more people. We have a couple of future directions that we are currently exploring. We have decided to tailor some of the EBA that we're offering on the assessment center to assist in culturally and racially informed approaches to assessment and therapy. Part of this is assessing specifically minorities' mental health experiences, knowing that oftentimes this is different than white folks' mental health experiences, and that those things need to be assessed in tandem with sort of the general depression, anxiety domains. And then also, in light of COVID, we want to create a battery and are currently in the process of identifying assessments that could fit into a COVID-related battery, primarily accessing anxiety and trauma associated with the COVID experience and potentially loss of loved ones and things like that. One of the other things that we're looking forward to doing at the moment is creating translations of assessments. So we already have compiled a bunch of PDFs of evidence-based assessments that are translated into multiple different languages, but we haven't encoded a ton of them into Qualtrics at the moment. So this concludes the presentation that I have on the Assessment Center, which is again created by Helping Give Away Psychological Science, or HGAPS. The bit.ly link that you see here, which is HGAPS AC in all caps, will take you directly to the Assessment Center. Alternatively, so you don't have to remember this bit.ly link, you can navigate to the Assessment Center by going to hgaps.org and then finding Assessment Center in the top banner. All the assessments and resources that I've talked about today have all been compiled on this website. So everything is completely integrated and in an easy to find location. So if you just remember taking these steps to get there, it should be all locatable. And also, please feel free to reach out to HGAPS if you have suggestions about content or format or anything like that. Our contact information is on the website, and we would be happy to hear from you and so glad to incorporate your feedback. Thank you so much for your time.